Thank you. We're scanning viruses. Does that take a while to do something? Or?
It'll run in the background.
Okay. Well, I'm going to give you a little presentation. This is the first time I've actually seen this final form, so we'll see. Anyway, I'm presenting this as if you're the audience in Panama City, okay? Many thanks to the organizers of this conference, Dr. Susan Lord and Jim Gordon, and to Julie Hilton for inviting me to participate in Food as Medicine, integrating nutritional medicine into clinical practice and medical education. Good morning to each and every one of you who are colleagues in the search for effective ways to enhance the well-being of those who look to us when they are ailing and hurting with psychiatric disorders. I applaud your attendance at this conference, demonstrating your interest in learning anew, suggesting you embrace the observation of the Greek philosopher Epictetus. Okay, there we go. Who taught that you cannot begin to learn what you think you already know. One of our missions as physicians is to observe and record for the benefit of humankind. What I've been asked to do in the next 45 minutes is to share some clinical observations during 45 years of medical psychiatric practice. That's 1 minute per year. So I will share my odyssey, which has included, especially during the early part of the 45 years, giving hundreds of electroshock treatments, prescribing the whole gamut of neuroleptic medications of the day, and having spent all too many anxious nights in intensive care because one of my patients took an overdose of medication I or one of my associates prescribed. And I've dealt with side effects, which at times produce devastating impairments due to the medications I or others prescribed. Since its inception 28 years ago, the center, which I am privileged to direct, has emphasized and focused upon orthomolecular principles. Because of that emphasis, my professional life has changed for the better. Imagine having a patient in intensive care, never having a patient in intensive care due to an overdose of medication you prescribed, something that reportedly happens thousands of times annually in this country. Imagine not dealing with devastating side effects such as tardive dyskinesia from medications you have prescribed. Imagine the joy that happens when your patient actually recovers from a severe psychiatric illness, no longer needing medication because you have enabled the correction of actual causative underlying biochemical factors rather than merely attempting to suppress symptoms. I will capsulize some actual clinical responses as examples of the effectiveness of the orthomolecular approach as experienced with a variety of individuals with psychiatric diagnoses that in many cases had not responded adequately to standard therapies. The National Institutes of Health is actively seeking a series of best case reports for what works in clinical practice. What follows are not just best cases, but are representative of hundreds of cases with similar correctable biochemical findings and similar outcomes among individuals who recognize they have a problem, are willing to be biochemically evaluated, and willing to follow through over time with what is prescribed. Hopefully, when appreciated together, these cases will increase the plausibility that the orthomolecular approach is one way to improve outcomes for psychiatric patients. However, depending on your orientation, the cases I present will be viewed as meaningless anecdotal reports or as important case studies pointing to the need for a better understanding of the biochemistry of behavior. Taken together, I hope they will suggest the plausibility of two concepts championed by Dr. Roger Williams. In his book, The Wonderful World Within You, Dr. Williams shares the concept of biochemical individuality. In my opinion, this concept is so important that a copy of his book is being made available to conference participants at no charge. The second Williams concept that motivates our approach is genotropic illness. Quote, "These are diseases in which the genetic pattern of the afflicted individual requires an augmented supply of one or more nutrients, such that when these nutrients are adequately supplied, the disease is ameliorated." If you are not familiar with Dr. Williams' work, much of what I will be discussing may seem foreign. And throughout history, we know that a view differing from established beliefs is most often treated like our bodies treat a foreign protein. It is rejected. That is why, in order to keep my perspective, I write little vignettes entitled Medical Mavericks. I research the history and write them to maintain perspective. After all, if Harvey couldn't get his colleagues to believe blood circulated, and Semmelweis couldn't convince his colleagues because they didn't wash their hands they were killing women, why should I worry about being attacked because colleagues don't yet realize the importance of nutrients in health and disease? I write these vignettes not only to keep my perspective, but also because history of medicine courses are no longer taught in all but 2 medical schools, one of which is elective. Because I believe understanding the history of medicine is so important, copies of Medical Mavericks, Volume 1 and 2, are also being made available at this conference at no charge. Now I'm working on my next book about those who became medical mavericks, not because they wanted to, but because they discovered the value of orthomolecular approaches to illness. This led to relative isolation and ostracism by those believing in the more mainstream toxomolecular way of treating human beings who had become ill with psychiatric disorders. When I was a youth, I had several white spots in my fingernails. The doctor told my mother that the white spots were there because I had bad thoughts. I knew he was right. And as an adolescent, a rather fat adolescent, there were many stria on my abdomen, similar to the stria seen in some pregnant women. The doctor said the stria were there because I was too fat. I knew the doctor was right. When I was a younger doctor practicing psychiatry, I met Carl Pfeiffer, PhD, MD, in Vancouver at a nutrition conference sponsored by Dr. Abram Hoffer. During one of the lunchtime breaks, Dr. Pfeiffer said to me, "You must have had a rough time 3 months ago." That was rather amazing to me, since I had experienced my first attack of gout almost exactly 3 months before. Wow, how did he know that? Because he said I had a large white spot in the middle of one thumbnail, which he said was due to a low zinc level at that time and an indication of a stressful period. And since it takes the fingernail about 6 months to grow from the base to the tip, a white spot midway would indicate that that part of the nail had been formed about 3 months earlier. Later that day, Dr. Pfeiffer spoke on what he believed to be a link between some schizophrenias and having the genetic difference of being a urinary pyrrole excretor. Pyrroles are very prevalent in the natural world. Both chlorophyll and hemoglobin are made up of pyrrole rings linked together either with magnesium or iron. He said those who have the genetic difference leading to a high urinary pyrrole excretion lose vitamin B6 and zinc in their urine. And he taught that one of the telltale signs of inadequate zinc was white spots in the fingernails and abdominal stria. 1 week after returning from that meeting, I saw a patient at a mental health center where I was a consulting psychiatrist. She was a teenager. She had been hospitalized for 3 months for the treatment of schizophrenia and was so heavily medicated that she was unable to attend any of her high school classes. She presented with 3 or 4 white spots in several fingernails. Without the benefit of any laboratory testing, which unlike today was unavailable at the time, I decided to try this very disturbed young lady on supplemental B6 and zinc. Over the next couple of weeks, she markedly improved. So much so that I slowly withdrew the neuroleptic medications. Before long, she was only taking B6 and zinc and had no evidence of being crazy anymore. This too was amazing to me. But neither the family nor the patient believed that such a simple treatment could be the answer to why she had suddenly improved. They figured it was just time for her to get well. So she stopped taking the zinc and B6, and within weeks was delusional and exhibited clinically obvious schizophrenic behavior. She became worse and worse until convinced to resume taking the zinc and B6. Her thinking became clear again. This on and off, well and crazy cycle was repeated 4 times until all parties agreed that perhaps the needed nutrients in sufficient quantity were the answer to keeping her healthy. Although the recurrent psychotic spells and initial lack of family acceptance were frustrating, the results of the intermittent use of zinc and B6 made a superb N-of-1 study. By going on and off the zinc and B6, she served as her own control. No need for a double-blind study in this case. The young lady went on to become a state champion baton twirler and a straight-A student. Years later, she had married and had 2 delightful children and was still taking zinc and B6. Dr. Pfeiffer had mentioned that pyrrole excretion was linked to schizophrenic disorders in about 20% of the patients. In addition to white spots in the nails, he indicated these people would complain of knee joint pain, probably due to inadequate zinc to make strong cartilage. I did not recall in my years of practice until that time that any of my schizophrenic patients had ever complained of knee joint pain. But since we kept very good records, I asked my staff to check if knee pain was indicated in histories of those patients. Again, much to my amazement, 19% of those with a diagnosis of schizophrenia indicated on the history form that they had knee joint pain. I just had not paid any attention to that symptom. This leads to a very important point. A large double-blind study in which all schizophrenics were given zinc and B6 would yield statistically dismal results. About 20% would improve, which is far below placebo effect. But if schizophrenics were selected according to their biochemical profiles, indicating high urinary pyrols, the portion among those that had positive results would approach 90%. Some of you will have white spots in your fingernails. Once I made that observation about the chief of a psychiatric section. He never acknowledged my letter to him, but the white spots gradually disappeared over time. Thanks to the excellent presentation by Drs. Gaby and Hoffer, we have learned how highly effective empiric use of specific nutrients can be. Obviously, the case I just presented supports that concept. However, especially among those who have not adequately responded to empiric approaches, we increasingly rely upon biochemical assessments to determine specific needs. I'm a strong proponent of biochemical assessments, especially in people diagnosed with schizophrenia. Just testing for urinary pyrols would yield significant findings, and with appropriate treatment of those testing positive, good therapeutic results. In 1975, when the center became an entity, 86% of our patients, all of whom had psychiatric disorders, were physician referred. Frankly, we saw people other doctors no longer wanted to see. Obviously, our results were sufficient for us to continue and grow. During that initial period, I was delighted any time someone came in as a pyrrole excreter, because I knew that person would be much better in a relatively short time just by maintaining a greater intake of zinc and B6. Now, of course, we have on-site laboratory facilities which can measure urinary pyrols and other significant biochemical factors, and do so for doctors and hospitals throughout the country. That is how I learned I'm a pyrrole excreter, and therefore have a greater need for zinc and B6 than the average person, as my medical history of white spots in my fingernails and abdominal stria would have indicated. Until a few years ago, standard medical text indicated that one of the most common results of inadequate vitamin C was the development of depression. Decades ago, we conducted studies at 2 area psychiatric hospitals. We simply measured plasma vitamin C levels in new admissions with a diagnosis of depression at St. Francis Regional Medical Center and Prairie View Mental Hospital. Results revealed that 34 to 41% of those with an admission diagnosis of depression had very low levels of vitamin C. How many psychiatrists measure the vitamin C in their patients who are depressed? As the astute researcher and observer, Dr. EMANUEL CHERASKIN observed, doctors don't think anyone is low in vitamin C because they never measure it. Many years ago, a teacher called because she was profoundly depressed. She reported previously having 3 years of psychotherapy. Her very ample sickness insurance would have paid me without question a handsome fee to see her for 1 hour of psychiatric consultation each week for 2 years. However, because of her inability to cope with her depression and profound fatigue, I chose to measure her vitamin C. Neither her plasma nor urine had any detectable vitamin C. She was below scurvy level. She was prescribed and took 500 milligrams of vitamin C twice daily. In 2 weeks, she thought a miracle had occurred. No miracle had occurred. She just needed vitamin C. Her total fees were for 2 hours of consultation and 3 plasma vitamin C levels, which the insurance company refused to pay because, in the limited view of the reviewer, vitamin C had nothing to do with depression. In that case, the insurance commissioner of Kansas reversed the company's decision and the patient was reimbursed. This is just one example that if results instead of process were paid for by insurance companies, the orthomolecular approach would become the first method of choice in the evaluation and treatment of mental and emotional disorders. Currently, our research division, the Biocommunications Research Institute, is supporting studies to show the effects on rats of the impact of the lack of a single nutrient while feeding an otherwise nutritionally complete chow. Here, for instance, I think, here are some photos. We don't, B6 disappeared. Let me see, just a minute. This is.
Hugh, whenever you put a picture on, it's going to be slow to come on, so just, you have to be...
Well, I understand, but this was really a video, but it's not a video. It's a series of stills, right? It's really, Anyway, here are Sprague-Dawley rats before being deprived of only B6 and after. You can see the comparisons, just a few weeks. Notice that there's been a rapid development of dermatitis of the legs, paws, tails, and nose. You can see the tremendous difference here. This is a little long. I'll probably come up with a little more verbs in there. And even the penis. That's for the psychiatrist. No. Now, what happens if only vitamin B1 or thiamine is withheld? You see how active and happy these rats are before they started being deficient in thiamine. Grooming, looking around. This is no thiamine after 32 days. This is a video. This is not a still picture of this rat. You can see very lethargic. This is a group of them, essentially not moving, no interest in their surroundings, pretty much looking wiped out. And of course, their skin looks as it's irritated. They're losing hair, plus their mates are eating their hair in an attempt to get some nutrients. But again, to be able to see a tremendous difference in what they have. So the question is, how many humans have their vitamin B saturation levels determined who are having symptoms like that, or psychiatric symptoms of being depressed, lethargic, and so forth? Speaking of B vitamins, I would like to dedicate this presentation today not to the very distinguished, well-known people who are here or will be mentioned, but to a man probably no one in this room has ever heard of. That man was my primary mentor of orthomolecular medicine before the term was advanced by Linus Pauling in his seminal article in the 1968 issue of Science entitled Orthomolecular Psychiatry. The man I'm speaking of is Fowler Pauling, MD, who during my first month of practice with him in 1958 taught me that the way he kept people out of the state mental hospital was by giving them intravenous vitamin B complex. This, of course, was at a time before there was any significant health food store where one could buy nutrient supplements. Intravenous vitamin B was so effective that we gave those injections 7 days a week. The patients came regularly because they reported not only feeling better, but in some cases they expressed literally feeling their craziness going away when the intravenous vitamin B complex took effect. Dr. Pauling had been doing that for several years before he asked me to join him. Unfortunately, he never published any of his observations or findings. In part, that was because his great powers of observation and his trust of what he knew to be true were cut short when he was killed riding as a passenger in an automobile. So I'd like to dedicate this presentation to his memory in recognition at the time of his death at age 48 in 1959. He had been practicing orthomolecular psychiatry for about 10 years without attaching the significance to that way he was helping people stay mentally healthy. In remembrance, I would like to thank him because without his belief in me and what he taught me, I would not be here today. In the days that I was with him, Dr. Pauling would often be severely criticized by psychiatric colleagues, not for outcomes, but for giving his patients intravenous B. I asked him how he stood the criticism. He said, "Hugh, you just have to be steady, and those critics will all fall by the wayside." And indeed they did, often in surprising ways. Years later, at the time of this picture, I asked Linus Pauling roughly the same question. How do you handle all the negativity about what you believe to be true? He said to me, "You just have to realize, Hugh, when your colleagues aren't up on something, they tend to be down on it." Is it possible that other factors, such as trace minerals, can be key to eliminating psychiatric disorders? Listen to an audio message recorded at a seminar on depression of one of our patients who totally eliminated all symptoms of depression following our discovery of what she needed. There's my arrow. I don't know if this,
did not feel better.
you probably can't hear that.
So I was
This is not pumped in, is it?
because I had 2 grandbabies that were going to come at the end of July. And I didn't want to see these grandbabies, and that's rather odd for a grandmother.
Oh, you're going to put it in there? That's a clever idea.
To helping these children of
Bill?
mine with those children.
Bill, turn on the other mic.
Turn on the mic. Son?
I knew we needed the income, yet in the year I had taught, I went, wandered away, and I was only there by walking in and walking out and trying to get some rest. I never got any sleep, and I wasn't worrying about my students because I felt confident that I could teach these students. I teach learning disabled students. I loved my job, but I didn't feel up to it. I knew something was wrong. One psychiatrist knew enough to send me here. And the medication I took, I responded completely the opposite of what the medication was supposed to help me with. And so the thing that changed it was calling back to the center and letting them know that I was not feeling any better. They decided to up the zinc that I was getting and give me double amount of liquid zinc, and Dr. Riordan told me how to take it. Instead of having it in a whole lot of water, I had it just in a smidgen of water. And in 2 days' time, when I had the double zinc, my husband is at the back, can wave at them. He can tell you he had a new wife, and he wasn't sure whether he was going to cope with a new wife, because he was always ahead of me, but now I'm way ahead of him. I've been able to do even better with my students at school. My learning disabled are not only not 2 to 4 years behind, they're ahead of their 3rd grade class. And I would attribute it to being on top of things nutrition-wise. I've done some more research here at the library, and I feel these things so different than when they kind of thought, well, it must be all in your head, honey. And when they didn't offer me anything except drugs. And the drugs did not help, and I could not sleep at night. So this wasn't just a light depression. It was an inability to cope with life. Inability to enjoy my family. We couldn't go out to dinner together because I was allergic to so many foods. Now I've gained too much, and now I'm glad to try to diet and watch what I eat. There's only one item that I cannot eat, and that's MSG, monosodium glutamate. This was the right answer, and so these 12 other doctors that would not look at nutrition.
We're going to shorten that a little bit. Can it be that simple? Thanks, Dean. That zinc in some people can eliminate depression? Why not? Zinc is involved in at least 100 enzyme systems in the brain. Zinc is a cofactor in multiple enzymes, RNA polymerases, synthesis of new proteins, alcohol dehydrogenase, DNA synthesis, neurotransmitter metabolism, metabolism of a variety of hormones, growth hormone, thyroid hormone, insulin, sex hormones, just to list a few of its actions. Another lady came to us from Phoenix, where she had been hospitalized 19 times by 3 different psychiatrists with a diagnosis most often given of schizoaffective depression. During the 3 months prior to coming to Wichita, she had not been out of her bedroom area in spite of multiple medications. We discovered that she had a very high tissue copper level, which did not respond significantly to usually effective ways of reducing copper, such as increasing zinc and chelation. So I called Carl Pfeiffer, who was still alive at the time. Oh, he said, she is one of those you have to give copper first before the usual methods will work. And work they did. After being well for more than a year without prescription medications, and after completing an office assistant course and going to work, she contacted the 3 psychiatrists in Arizona who had hospitalized her. She wanted to relate to them, not in a hostile way, what she had done to get over the long-standing depression. She thought the doctors would like to know. However, none of the 3 would see her, giving the reason they were too busy. A beautiful young lady, also from Arizona, came to us because her family wanted a second opinion as to why she would periodically become psychotic at work in a restaurant bar. Standard psychiatric thinking indicated on her extensive records suggested that her main problem was she was so good looking that she would be frequently hassled by customers who were attracted to her. The notion was that she just couldn't take it and periodically would become psychotic as the evening wore on. Many strategies had been suggested by psychiatrists to help her cope with the often undesirable attention she received from libidinally driven males. She became a wonderful teaching case for our then new pathologist and laboratory director, who wasn't quite sure about the merits of a blood test used to detect adverse food reactions. We prefer this test for food reactions when mental symptoms are involved because the interpretation is based upon white blood cell responses which adversely react to certain foods in some individuals, especially in people who report brain fog or a sudden change in their behavior within 4 days of eating or drinking particular foods or beverages. Upon thoroughly reviewing her history and the sequence that most often preceded her psychotic episodes, it seemed she might be having a reaction to specific alcoholic beverages. The screening test demonstrated that her white blood cells were in fact affected by 2 different alcohols. We sought to verify her problem by performing a challenge test. She arrived at a laboratory fasting at 8:15 in the morning. She was beautiful, not only lucid, but charming and entirely calm. Half an hour after receiving 2 ounces of a specific beer and 1 ounce of gin, she was totally psychotic, screaming and so agitated that our skeptical pathologist had to assist the ambulance attendants in controlling her agitation en route to the hospital. Suddenly, the pathologist became a believer. Over a period of 3 years, by avoiding the offending substances, she had no more psychotic episodes while working at the same job and going to school. What do we see microscopically at magnification of about 600 is happening to the blood cells? This is a view of normal, unstained blood. We see a full field of red cells, white cells, and platelets. With someone who has mild to moderate adverse reaction, you'll note that there seems to be fewer cells. With a strong reaction, as happened with the alcohols, we see, even with an untrained eye, a much less dense field because the cells and platelets have disintegrated. While attending a large Christmas party, while attending a large Christmas family dinner at her home during a holiday break from Yale, a young lady changed from a pleasant conversationalist to running up to the balcony overlooking the dining area, ripping off her clothes and screaming obscenities. While hospitalized under my care, it was discovered that her white blood cells demonstrated severe adverse reactions to both red and green dyes, which were used in the frosting of the cake she ate for dinner before what proved to be her second psychotic episode. Now let's look at a time-lapse close-up of what happens to a white blood cell having an adverse response. Let me find my arrow here. As you know, MSG is an excitatory substance which in some people causes significant symptoms such as Chinese restaurant syndrome. In this case, MSG caused a dramatic white cell response. You'll see that if you're used to looking at white cells that the granules are very active in this cell, but it produces the effect of destroying the cell, which is why there are so many fewer cells on this particular test. Now, just how many different biochemical abnormalities do people exhibit who come to the center because of psychiatric problems? Let's look at some findings in a small group of children. In preparation for this presentation, I reviewed the charts of 6 young patients who came to us with referring diagnoses of ADHD, pervasive development disorder, or autism. I would like to briefly review what in-depth laboratory evaluations of these children revealed. Number 1 was a nonverbal male, age 4, probable autism, high urinary pyroles, high candida, positive indican, low GLA, low EPA, cytotoxic to both BHA and BHT. Number 2, ADHD, allergies, constipation, male, age 8, high urinary pyroles, positive indican, low zinc, low hemoglobin, low GLA, low EPA, cytotoxic, +3 to BHA. Number 3 was ADHD, male, age 11, low B1, low vitamin C, amino acid abnormalities. Number 4, ADHD, allergies, dermatitis, male, age 10. Amino acid abnormalities, low zinc, cytotoxic, +3 to garlic and BHA, low vitamin C, positive indican, low white blood count. Number 5, pervasive development disorder, male, age 9, low vitamin C, low GLA, low EPA, amino acid abnormality, high candida, low chromium, parasite, Dientamoeba fragilis. Number 6, autism, dermatitis, male, age 8, low vitamin C, positive indican, high candida, high TSH, high EBV, positive cytotoxic to multiple foods. What does the review of the findings just mentioned of these 6 children tell us? Well, first of all, we notice that boys outnumber girls, in this case 6-0. Throughout the world, far more boys than girls are diagnosed with ADHD or autism. The relative incidence of abnormal findings is apparent in this summary. As you can see, each had correctable biochemical problems. Looking at the tabulation, I hope you will concur that a more complete biochemical assessment may point the way to therapeutic interventions based upon biochemical individuality that actually correct underlying biochemical aberrations. No.
I didn't get that from that slide, so I don't know if there's some way to improve that. You know, I don't see how that slide makes that point. Maybe I'm just not seeing it.
If you'd wait.
Okay.
Sit down. Thank you. Would providing zinc and B6 be useful to these children? And will. Probably for 1/3 of them. Would omega-3 fatty acids be useful in these children? Probably in half of them. Would supplemental B6 be useful in these children? Probably in 2/3 of them. Does that make it more clear as you're looking at the odds, or not yet? Okay. In our experience, correcting the biochemical problems will tremendously improve and at times eliminate behavioral problems entirely. Now, for a long view, I would like to share information about a little boy who came to us in 1977. His name was Billy, or is Billy, age 9, from Detroit, Michigan. He was referred by a research psychologist at Northwestern University. Billy had headaches, stomach aches, a profound school phobia, inattention, apparent fear of teachers, and lack of social interaction, which led to enormous frustration for all concerned. Billy had been given multiple diagnoses as the result of multiple evaluations, as his educator parents sought help for him for more than a year. After testing at the center, it was determined that Billy had a greater than average need for vitamin B6 and zinc due to genetic factors, and he had profound adverse reactions to sugar cane and cornstarch. Billy was then put on a diet of unprocessed whole foods, which was supplemented with extra vitamin B6 and zinc that his body needed. Over several months, Billy began to improve, and his parents reported he had no longer dreaded going to school. In fact, after many ups and downs, he eventually achieved perfect attendance in both school and sports activities and did well scholastically. He returned to the center in 1995 for reevaluation to see how his biochemistry was doing. His assessment showed that he had excellent levels. As of our last contact in 2002, Billy, now Bill, had graduated from college as a successful teacher and sports coach and is married and enjoys good health. Now I would like to share a typical laboratory assessment, the type of protocol we use developed over the years to detect biochemical differences in a new adult patient referred because of a diagnosis of schizophrenia. Of course, the actual protocol is adjusted based upon the history and initial consultation. A thorough evaluation would include the following: amino acid fractionation, antioxidant profile, B-complex profile, blood histamine chemistry profile, cytotoxic food sensitivity, red cell membrane fatty acids, red cell trace mineral profile, and urinary pyrroles. If I could only choose one test, it would be a series of 3 urinary pyrroles. One when the individual had an ordinary day, one on a calm day, and one on a stressful day, because pyrrole excretion markedly increases with stress. The protocol for the assessment of an individual with significant depression would be similar, but if I could evaluate only one factor, it would be to measure plasma and urine vitamin C. There is increased interest in the gene or genes that may be linked to mental disorders such as depression. While that is of interest, we all know that we must have a gene for anything to occur. We can't have a zit without the gene, but most of us don't have zits all the time. Whether a gene is turned on or off is what is important. That is what's termed epigenetic phenomena. In my opinion, most of the epigenetic switches are nutrients or their lack. We have seen how the withholding of a single nutrient produces epigenetic changes in rats in just weeks. The rat's genes did not change. Now I'd like to show you a human also demonstrating an epigenetic phenomenon. This young man, from the time he was 10 months old until he was 17, lived a miserable life, almost dying twice from medical therapies. Of course, he was depressed. Finally, someone discovered that he needed more zinc, 4 times the zinc of a normal person. This sequence shows him at age 17. The first photo on the left is before any treatment. The second is 1 week after starting treatment. Start to see a little improvement. Next picture on the left is 2 months later. On the right, 4 months later, and about a year later. He is a superb example of Dr. Williams' concept of genetic tropic disease. The augmented supply of a needed nutrient ended years of misery. While changing from a freakish appearance to being very good-looking, this young man's genes were the same. His gene was turned on or off by the zinc. My neurology professor at the University of Wisconsin taught us that diagnoses were not missed because the doctor didn't know, but because the doctor didn't look. That concept has motivated me for 45 years to look beyond descriptive diagnoses based upon behaviors. Doing so has brought great satisfaction to me and many I have treated and served as their doctor. Therefore, I encourage you to consider looking, perhaps in ways you haven't looked before, to discover for yourself whether what I have presented are meaningless anecdotal reports or significant case studies that suggest plausible biological keys to helping some of your patients live a better life. To do so would, of course, mean that you would be going against the tide of established practice. However, I take great comfort, as you might, in the observation of Malcolm Muggeridge, which is, never forget that only dead fish swim with the stream. That's the deal. Oh, we can get that in.